How is surgical dehiscence managed after an operation? Imagine waking up after surgery only to find that your wound has opened up. That's what surgical dehiscence is, when a surgical wound reopens after closure. It can happen after any surgery, including plastic procedures, and managing it properly is essential for healing and safety. So, how do doctors handle this tricky complication? First, the healthcare team will carefully examine the wound. They look at how deep it is, how much it has opened, and whether there are signs of infection like redness, swelling, or pus. This assessment helps determine the severity and guides the next steps. If infection is suspected, antibiotics are prescribed based on culture results and guidelines. The wound is gently cleaned, and dead or damaged tissue is carefully removed through a process called debridement. This clears the way for healthy tissue to grow back. Keeping the wound moist and clean with regular dressing changes is also vital. Sometimes, advanced dressings or negative pressure wound therapy are used. Negative pressure therapy involves applying a vacuum to the wound to promote blood flow and remove excess fluid, which can speed up healing. In more serious cases, especially when deeper tissues are exposed, a plastic surgeon might need to perform surgical revision. This could involve restitching the wound, sometimes using tissue flaps or grafts. Flaps are sections of healthy tissue moved from nearby areas to cover the wound, providing better blood supply and support for healing. When primary closure isn't possible, staged procedures might be planned. This means temporarily closing the wound until it's ready for final reconstruction. Supporting the patient is also crucial. Managing pain effectively, ensuring good nutrition, and controlling underlying health issues like diabetes help the body heal faster. Patients are educated on how to care for their wound, recognize signs of problems, and avoid activities that could cause further injury. In plastic surgery, the goal is to restore both function and appearance. Surgeons use meticulous techniques to minimize tension on the wound and often layer sutures to distribute forces evenly. If dehiscence occurs, early consultation with a plastic surgeon is important. They might use specialized techniques like flaps or grafts to restore the wound's integrity and preserve aesthetic results. Negative pressure therapy can be especially helpful in larger or contaminated wounds, preparing them for final closure. Prevention is always better than treatment. Before surgery, doctors work to optimize the patient's health by managing nutrition and blood sugar levels. During surgery, careful handling of tissues, proper suturing techniques, and avoiding excessive tension help prevent dehiscence. After surgery, patients are advised to rest, avoid strenuous activities, and follow wound care instructions closely. Strict aseptic techniques and timely antibiotics also reduce infection risks. Managing surgical dehiscence requires a patient-centered approach that emphasizes safety and evidence-based care. Every case is unique, and treatment plans should be tailored to individual needs. Patients should always consult qualified healthcare professionals for personalized advice. Remember, proper management and prevention are key to ensuring healing, safety, and the best possible aesthetic and functional outcomes after surgery.